the patient, introduce yourself, and explain what you're going to do. Inspection of the head. For the hair, note its quantity, distribution, texture, and pattern of loss, if any. You may see loose flakes of dandruff. For the scalp, part the hair in several places and look for scaliness, lumps, nevi, or other lesions. For the skull, observe the general size and contour of the skull. Note any deformities, depressions, lumps, or tenderness. Learn to recognize the irregularities in a normal skull, such as those near the suture lines between the parietal and occipital bones. For the face, note the patient's facial expression and contours. Observe for asymmetry, involuntary movements, edema, and masses. For the skin, observe the skin, noting its color, pigmentation, texture, thickness, hair distribution, and any lesions. For the eyes, first we need to test for visual acuity. Position the patient 20 feet from the chart. Ask the patient to remove reading glasses, if any. Test for visual acuity one eye at a time. Determine the smallest line of print from which patient can identify more than half the letters. Interpret the reading correctly. Second, test the visual fields. Ask the patient to look with both eyes into examiner's eyes. Place hands 2 feet apart, lateral to patient's ears. Instruct the patient to point the fingers as soon as they are seen. Move the wiggling fingers along imaginary bowl and toward the line of gaze until patient identifies them. Third, eye inspection. Stand in front of patient. Survey eye position and alignment. Note the eyebrow quantity and distribution and scaliness of skin under the eyebrows. Check for edema and redness of the lids. Check for direction of lashes. Check for adequacy with which the eyelids close. Ask the patient to look up. Depress lower lids with thumbs. Describe the color of sclera and palpebral conjunctiva. Ask the patient to look to each side and down. Check for lens opacity and check for concentric shadow. Fourth, pupil inspection. Inspect the pupil for its size, shape, and symmetry. Ask the patient to look into distance. Bright lines shown obliquely into each pupil. Describe the direct reaction and the consensual reaction. Fifth, check the extraocular muscles. Check for conjugate movements. Ask the patient to follow the pen light. Check the 6 cardinal directions of gaze. Check for nystagmus. Examination of the ears. First, inspection of the external and inner ears. Pull the auricle upward and backward. Hold otoscope between thumb and fingers with the speculum directed down and forward. Inspect the ear canal for discharge, foreign bodies, redness of the skin, and swelling. For auditory acuity test, test one ear at a time. Use whispered words or sound of objects. For Weber's test, place base of tuning fork on top of patient's head or mid-forehead. Ask where the patient hears tuning fork. Correctly interpret the findings of the test. For Renee's test, place base of vibrating tuning fork on the mastoid bone. Place fork close to the ear canal when patient can no longer hear the sound. Ask if the patient can hear the sound again. Correctly interpret the results of the test. Nose examination. Inspect the anterior and inferior surfaces of the nose. Note for tenderness of the nasal tip. Note any asymmetry or deformity of the nose. Test for nasal obstruction. Observe for any discharges. Rhinoscopy. Check the nasal mucosa for color, swelling, and bleeding. Check the nasal septum for any deviation, inflammation, or perforation. Check for abnormalities like ulcers or polyps. Paranasal sinus examination. Palpation of the sinuses. Press the frontal and maxillary sinus and check for any tenderness, pain, nasal discharge, heaviness, and fever. Mouth and pharynx examination. Inspect the lips. Check the color, the moisture, and check for any cracking or scaling among the lips. Inspect the oral mucosa, the gums and teeth, the roof of the mouth, the tongue and floor of the mouth. Inspect the pharynx. Inspect the soft palate, the tonsillar pillars, the uvula, and note for any exudates, redness, and swelling. Neck examination. Survey and inspect the neck, noting its symmetry and any masses or scars. Look for enlargement of the salivary glands and note any visible lymph nodes. Lymph nodes. Palpate the lymph nodes. Use the pads of your index and middle fingers. Patient should be relaxed with the neck flexed slightly forward. Examine both sides of the neck at the same time. Note the size, shape, mobility, consistency, and tenderness of each lymph node region. The preauricular, posterior auricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical, and the supraclavicular region. Trachea. Inspect the trachea for any deviation. Place your finger along one side of the trachea and note the space between it and the sternocleidomastoid. Compare it with the other side. Inspection of the thyroid gland. Ask questions regarding thyroid problems.
Have you noticed any weight change? Experience heat or cold intolerance? Change in bowel habit? Become anxious or irritable? Any palpitations? Any problems with climbing the stairs? Numbness or tingling in hands? Tremors?
Palpate the thyroid gland. Stand behind the patient. Place the fingers of both hands on the patient's neck just below the cricoid. Adjust the patient's neck extension to avoid tightened neck muscles. Ask the patient to sip water or swallow saliva. Feel for a glandular tissue rising under your finger pads. Upon palpating the thyroid gland, note the size, shape, and consistency. Identify any nodules of tenderness. If the thyroid gland is enlarged, listen over the lateral lobe with a stethoscope to detect bruit sound in carotid area. Document the pertinent findings.